Welcome to Chapter 11a. We are skipping over Chapter 11. We're going to dive right into enhancing your body image. You are welcome to read over Chapter 11. We will touch it a little bit in class. But for our purposes for this lecture, we're going to focus on enhancing our body image. And our body image is really influenced by a wide range of cultural, individual, and interpersonal factors. And it can be either positive or negative. And it's really, do we like what we see in the mirror? We're going to take a look at some disordered eating. And we're also going to talk about the dangers and negative health consequences of exercise disorders as well. Body image refers to what you believe or emotionally feel about your body shape, weight, and general appearance. There are several components to body image. How you see yourself in your mind, what you believe about your appearance, including your real perceptions about your body, how comfortable you feel about your body, including your height, shape, and weight, how you sense and control your body as you move, how you behave in relation to your thoughts and feelings about your body. A negative body image is either a distorted perception of the shape or feelings of discomfort, shame, or anxiety about your body. And a positive body image is a true perception of your appearance, seeing yourself as you truly are. Researchers have developed a body image continuum that may help you decide if you have a positive or negative body image. And within the body hate dissociation, that's looking in the mirror and just saying, like, I really hate what I see. I hate looking the way that I look in the mirror. The distorted body image might say, I wish I could change something. I wish I could change the way I look in the mirror. Body preoccupied or obsessed is thinking that I think I'd be more attractive if I were thinner, if my nose were shaped differently, if I had smaller ears. Body acceptance is that my self-esteem is not based on what I look like. It's, I believe people like me for my personality or my achievements and not just my body image. And then body ownership is understanding or knowing that, you know what, people are going to love me no matter what I look like. People can't always manage the way that their body looks, right? And so there are a lot of problems are developed from that. So illness can create ways that our body necessarily doesn't want to look, or not ways that we don't want our body to look. Women, when they have a child, their bodies are not the same afterwards. So there needs to be a level of body acceptance and body ownership. We need to learn to love the skin we're in. Many factors influence our body image. Media images tend to set the standard for what we find attractive, and changing our bodies and body parts to better achieve what current society feels is beautiful has long been a part of our American culture. We really keep those plastic surgeons in business. Social media popularity has also increased concerns regarding negative body images. In a culture where more than 2/3 of adults older than 20 years old are overweight or obese, a significant disconnect exists between the media's idealized images and the typical American body. Family, community, and cultural groups also have an influence. The people with whom we love and most often interact strongly influence the way that we see ourselves. Peer harassment, teasing, and bullying is widely acknowledged to contribute to a negative body image. Associations with one's cultural group appear to influence body image. There are also physiological and psychological factors. Body image disorders have been linked with the brain's ability to regulate neurotransmitters, which are linked with mood. To develop a positive body image, we need to challenge these 4 myths. Myth 1. How you look is more important than who you are. Myth 2, you can look like the celebrities if you work hard enough. Myth 3, extreme dieting is an effective weight loss strategy. And myth 4, things will go better for you after you achieve the perfect body. These are all myths. The majority of people you see in magazines are photoshopped. Body dysmorphic disorder, BDD, is a body image disorder. And people with this disorder, they're obsessively concerned with their appearance. And they have a distorted view of their own body shape, size, weight, perceived lack of muscles, so on and so forth. What they see in the mirror is totally distorted from what is actually happening or what they actually look like. The exact cause of this is unknown, but it's often accompanied by an anxiety disorder or obsessive compulsive disorder. Let's take a look at disordered eating and eating disorders. There's a difference between disordered eating, which is a pattern of atypical behaviors used to achieve or maintain a lower body weight. Behaviors include chronic dieting, abusive diet pills or laxatives, self-induced vomiting, and many others. But eating disorder, it's a psychiatric disorder, and it's characterized by severe disturbances in body image and eating behaviors. Eating issues occur along a continuum, and so you can see in the orange to the left is eating disordered, and then it moves to disruptive eating patterns, food preoccupied or obsessed, concerned in a healthy way, and food is not an issue. So you really want to be more towards the right, if at all possible. Oftentimes when people get overly concerned with the scale, they start moving towards the left. And there are a number of other ways to measure health than what a number has to say for you on a scale. 20 million women and 10 million men in the United States will suffer from some sort of eating disorder over their lifetime. These disorders include anorexia nervosa, bulimia nervosa, binge eating disorder, and other specified feeding and or eating disorders. They're on the rise among men who currently represent up to 25% of anorexia and bulimia patients. In 2015, 2.6% of college students self-reported as having anorexia or bulimia. It's really common among ballet dancers and athletes, particularly sports with an aesthetic component, needing to look good at what you're doing. So gymnasts, dancers, many people with disordered eating are clinically depressed. They have obsessive compulsive disorder or have other psychiatric problems. Many people feel disempowered in other aspects of their life. And to try to gain sense of control, they use food. And that's another component of the disordered eating. Anorexia is a persistent chronic eating disorder characterized by deliberate food restriction and severe life-threatening weight loss. Estimates suggest 0.9 to 2.0% of women suffer from anorexia nervosa in their lifetime. And it is accompanied by starvation, distorted body image, purging through vomiting, or using laxatives. The causes are complex and variable. So there's a number of reasons. There's just not one cause that brings people to anorexia. So this is an image of what anorexia can do to the body. Hair thins and becomes really dry and brittle. It really affects all of your organs. Your skin becomes really dry and discolored. You're easily bruised due to anemia because you're not getting the iron that you need. You might grow other hair because you're not getting, the hormones are being altered in your body. Decreased immune function makes infections more likely. Heart disturbances, including low blood pressure and irregular heartbeats. And it affects your reproductive system and your fertility. Nails turn brittle, muscle tissues are lost, bone density and bones lose density and fracture more easily. You end up with digestive problems. Kidney failure can lead to dehydration and death. It's really hard on your body because your body is really seeking out food, and you actually end up chipping away at yourself because your body is eating away at itself. And then your brain, you've got altered levels of neurotransmitters, and it leads to depression, anxiety, fatigue, fainting, and just overall impaired functioning. Bulimia is characterized by binge eating, followed by compensating with vomiting, or taking laxatives, excessive exercise to lose those calories that were just consumed. So there's a binge and there's a purge. People with bulimia are obsessed with their bodies. Weight gain and appearance are often hidden from the public eye because their weight may fall within a normal range. Or they may even be overweight. A combination of genetic and environmental factors is thought to cause bulimia, and up to 3% of adolescents and young women are bulimic. Rates for men are about 10% of female rates. So bulimia has its own host of issues how it can affect the body. Your throat can become inflamed, and glands in the face, neck, and jaw become swollen and sore. That's from the vomiting because there's acid in the vomit. The tooth enamel erodes, leading to pain and sensitivity. Again, the acid in the vomit. Blood levels of electrolytes fall, dangerously low, anemia and low blood pressure drop. Kidney malfunction, again, the dehydration, can result from diuretic abuse and vomiting. So the diuretics are the laxatives, and things that make you urinate because they want to expel their urine as well. Laxative abuse can cause rebound constipation. So you're going with the laxative, and then all of a sudden you're just like, everything clenches up and you are not going at all. Pain, diarrhea, and bloating result from digestive dysfunction. The stomach can enlarge and even rupture with ulcers, and bleeding may occur. The electrolyte imbalances can lead to arrhythmia and cardiac arrest. Esophagus can become inflamed or rupture. The backflow of the stomach acid causes heartburn. And then you also have altered brain chemistry. It can cause depression, anxiety, dizziness, impaired functioning. Use of diet or stimulant appetite suppressants, and you may end up with addiction as well. So there's a compounding factors that can happen within the body stepping into bulimia. Lots of long-term effects. Individuals with binge eating disorder gorge like those with bulimia, but they do not take the excessive measures to lose the weight that they gain, and they are often clinically obese. And the lifetime prevalence of binge eating is 1.4%. This image, believe it or not, is the same individual 1 year apart. This is Christian Bale. And on the left, it was his role in The Machinist. That's actually him. They are not photoshopped images. He used excessive dieting and actually became anorexic for this role. And then on the right, you see him a year later in 2005 in Batman Begins. So he was careful. He was under careful watch of trainers and people helping him through this. I believe that he actually nearly died in the making of The Machinist because of how thin he got and his body was starting to shut down. The problem with this in treatment, and we'll talk about this in a minute, is that when we start going in the other direction and starting putting the weight back on, that is often even harder on the body than it was when the person was in starvation, because the body doesn't really know what to do with all of that food. And so treatment is really hard on the body, but it can be overcome. But this is just two big extremes, and this is actually really dangerous to fall within these lines of going from such extreme weight loss to back to healthy weight. And maybe even a little bit more. Some patterns of disordered eating qualify as a legitimate psychiatric illness, but don't fit into the strict diagnostic criteria for anorexia, bulimia, or binge eating disorders. And in this case, the disordered eating is called OSFED, otherwise specified, which includes 5 subtypes. That's night eating syndrome, purging disorder, binge eating disorder, of low frequency or limited duration, bulimia nervosa of low frequency or duration, and atypical anorexia nervosa. So not all of it lines up with that purple book, that DSM diagnostic manual, but it is still considered disordered eating. One other is orthorexia nervosa, and this is an unhealthy obsession with what would be otherwise healthy eating. So people become fixated on food quality and purity and consumed with what and how much to eat. What eventually happens is the food choices become so restricted that the health suffers for that person. There are no quick fixes. There's no quick or simple solutions for disordered eating or eating disorders. Treatment often focuses first on reducing the threat to life because of all of those symptoms we talked about. Those are some life-threatening things. Cardiac arrest, pretty serious. Once the patient is stabilized, therapy focuses on the psychological, social, environmental, and physiological factors that have led to the problem. So it's the underlying problems that need to be touched upon, not just here, eat the food. The food isn't the problem. It's typically a sense of control that the person is feeling, or depression, and they need to have some sort of control in their life. What may have started off as a body image component, there's often so many other factors to it. Through therapy, the patient works on adopting new eating behaviors, develops a better relationship with food, building self-confidence, and finding other ways to deal with life's problems. With treatment, long-term recovery rates range from 44 to 76% for anorexia and 50 to 70% for bulimia. Without treatment, 20% of people suffering with a serious eating disorder will die from it. Helping someone with disordered eating is knowing the difference between facts and myth, recognizing that eating disorders are more than eating patterns. Be honest, be caring but firm. Compliment your friend's personality, success, accomplishments, not just, oh, it looks like you've lost a few pounds. I hate that compliment. Be a good role model and tell someone. If you need help, see something, say something, right? We all hear about that. But seriously, if this is outside of your realm and you feel that you need help, there are people to help. Believe it or not, there are also exercise disorders. And compulsive exercise is also called anorexia athletica. It's compulsive exercise. It's characterized not by a desire to exercise, but a compulsion to do so. The person struggles with guilt or anxiety if he or she doesn't work out. People over-exercise compulsively to feel more in control of their lives. Disordered eating or a true eating disorder is often part of the picture. And compulsive exercise can lead to a variety of injuries, including significant stress on the heart. Muscle dysmorphia is a body image disturbance and exercise disorder in which a person, usually male, believes that his or her body is insufficiently lean or muscular. Behaviors include comparing oneself unfavorably to others, frequently checking one's appearance in the mirror, and camouflaging one's appearance. They're also more likely to abuse anabolic steroids and dietary supplements. The female athlete triad involves 3 interrelated disorders. Now, note that there is a dancer pictured, and so this happens a lot when we're looking at the female athletics where the body lines are really important and part of like the judging and performance. There's a low energy intake, typically prompted by disordered eating behaviors. Many dancers suffer from bulimia or anorexia. There's menstrual dysfunction, such as amenorrhea. There's the absence of. And there's also poor density, poor bone density, that are all a part of this female athlete triad. Healthy at Every Size is a community that talks about well-being and healthy eating and exercise habits being more important than a number on a scale. I think I mentioned that earlier. So all of us, no matter our size, should accept our size. We don't have to wait to be a different size, a different shape, to begin self-acceptance and embrace life. Be happy with the skin you're in. Be healthy and be well. See you guys in class on Thursday.